I wanted to welcome you all today to today's webinar on the BioFlex personal therapy system, specifically for treating chronic conditions. These webinars that I do two types. I do one for healthcare professionals or clinicians, although anyone can listen in, obviously. It's geared a little bit more towards clinical practice and using our professional therapy systems and so forth. I also do a webinar a month for the personal therapy system, so more geared towards the general public, but I think the information is also valuable for clinicians as well. But obviously the language that I use, that kind of thing, may be a little bit more geared towards the general public as opposed to a healthcare professional. So we're going to get started. The idea today is just to understand some nuances about using the equipment, talking a little bit about some of these chronic conditions and chronic inflammation, a little bit of research, and hopefully some ideas on how to tackle treating chronic pain and helping out your symptoms for the long term. I will be taking questions at the end of this, so please type them in as we go along, but I won't be responding to them until the end of the webinar. So as always, I just do a little bit of a review over what the personal therapy system is. I'm going to talk a little bit about the effects of photobiomodulation, especially as it relates to chronic pain. Excuse me. Then I will just briefly talk about inflammation and chronic pain as it relates to some of the common conditions, and then get into strategies to treat chronic pain with the BioFlex personal therapy system. I do have an announcement as well, it being Black Friday, that we're joining in on that, and we do have a sale that's happening today. I'll make the announcement at the end of the webinar as well. We don't do this very often. It's probably once a year or something that we do it. So if you are in the market for one or interested, I'll give you the details on that. And then of course, I always take time for questions and answers at the end of the webinar. As many of you are aware, that we manufacture two types of personal therapy photobiomodulation devices, a BioFlex 120 and a BioFlex 180. Essentially, they're pretty similar. The difference really is that the size of the array, the light array. The 120 has 120 superluminous diodes, and the 180 has 180, obviously. The array itself emits two wavelengths, red at around 660 nanometers and near infrared at about 840 nanometers. And they come out of the same diode in sequence during the treatment. The controller unit looks something like this. Basically, you would punch or touch the specific area that you're treating, and I'm going to talk about some of these buttons as we go along as to what you'd be using for these chronic conditions. I want you to especially pay attention to the treatment stage. That's at the very bottom. And the treatment stage will vary according to what you're treating, whether it's chronic or maintenance, that kind of thing. And I'll talk a little bit about that, obviously, as we go along in today's webinar as well. The physiological effects of laser therapy, or I'm going to refer to it as photobiomodulation as well, because that's really the research term that's being used nowadays. I've talked about this a lot in all my webinars, everything from circulation through bone formation and nerve regeneration. But specifically, when we're dealing with chronic conditions, part of the target is improving circulation, improving blood circulation, controlling inflammation and swelling, and especially in the cases of chronic degenerative changes like osteoarthritis and rheumatoid arthritis, the goal is to try to slow that progression down and perhaps even regenerate some cartilage tissue as well, which research has shown that photobiomodulation can do to some extent. How light therapy works, photobiomodulation, is really through two different ways. One is directly. So for example, if I'm shining the light, these wavelengths of red and near infrared directly on a cell that's inflamed or injured, in this case it's a neuron, but it could be any cell. The mitochondria, which are of course the powerhouse of the cell, and produce energy, they're affected quite a bit in inflammation, and they tend to not work very well. So in essence, these damaged mitochondria are a big cause of chronic pain and symptoms. When exposed to light directly, these mitochondria can actually be restored or improved upon with respect to the ability to produce energy. So that's one way that photobiomodulation or low-level light therapy, there's different acronyms that one can use how it works. But another really important effect, especially one that the personal therapy systems focus on, is the systemic effect or indirect effect. So when you treat blood, even bone marrow, for prolonged periods of time, I'm not talking for a few seconds or a minute, I'm talking about quite a few minutes in a row, 10, 15, 20 minutes in a row, you actually will be exposing a fair amount of white blood cells and stem cells, platelets, and so forth. And these wavelengths of light that I've talked about are also absorbed by these what are referred to as immune cells, and immune cells control inflammation. So when you modulate these white blood cells, these immune cells, it has a positive effect, and they're carried throughout the circulation, typically around the area that you're treating. And of course, the circulation will reach the tissues, like arthritic tissues and so forth, that are injured, inflamed, and it will help them with respect to repair, and it will help reduce inflammation. So that's really how, in part, how photobiomodulation and how the personal therapy systems are working. Now, when we talk about inflammation, everyone's well aware of acute inflammation. That could be a trauma, a fresh injury, a burn, laceration. I think everyone's familiar with the acute inflammatory process. Now, chronic inflammation is a much trickier concept. Acute inflammation can turn into chronic inflammation. However, there's other causes of chronic inflammation. And really, unfortunately, when you're dealing with chronic inflammation in the body, this can cause a whole myriad of different types of problems, everything from cardiovascular disease, like if you think about arteriosclerosis, to neurological diseases that Dr. Ashley Bonjon in South Africa has been treating a lot with our equipment, to autoimmune disorders, rheumatoid arthritis being one of them, cancer, fibromyalgia, chronic fatigue syndrome, those kinds of things can be caused by, or at least made worse with, chronic inflammation. So really, chronic inflammation is one of these things that we need to try to control in different ways. And it's not just obviously using photobiomodulation. At the end of today's webinar, I'm going to talk about some strategies to reduce chronic inflammation other than just photobiomodulation. But specifically today, I'm going to be talking a bit about osteoarthritis and rheumatoid arthritis, which is an autoimmune disorder, and fibromyalgia. Those are the main things I'm going to talk about today. Chronic inflammation, as I mentioned earlier, is quite complex, and don't worry, I'm not going to get into this, but I want to pay attention to specifically some of these interesting chemicals. If you look carefully, you'll see things like IL-17 and IL-1, IL-12. IL refers to interleukin. It's basically a chemical secreted called a cytokine by white blood cells, and depending on the type of interleukin, it can either help resolve inflammation, or it can actually progress and make inflammation worse. And there's been a huge amount of research to indicate that photobiomodulation basically helps white blood cells secrete anti-inflammatory interleukins, or ILs, and decrease pro-inflammatory interleukins. So that's one of the ways that photobiomodulation works for chronic inflammation. As far as what pain is, I think everyone is familiar with experiencing pain. I won't read that out. But chronic pain, by definition, is the study of pain that basically is apparent in the body with no biological value, and is persistent, and usually, definitions vary, but in and around the 3-month point is where you're going to really start to consider something being chronic. What's really fascinating is that acute pain tells the body that there's something wrong and to protect the area. Chronic pain is of no value. And that's one of the things that a lot of patients don't understand is that they tend to not be active or not do things that kind of make their pain a bit worse, but isn't the source of the cause of the pain. So one of the strategies to help overcome chronic pain, believe it or not, is to be as active as possible. And I'll talk about that near the end of today's lecture. So in Canada, anyhow, chronic pain is quite prevalent. It's higher in women than men. That's probably because women tend to go see their doctors more than men do. But it's quite a high percentage. And of course, it increases as you get older. And if you look at the 55 plus age bracket, you're pushing 40% of patients that have some type of chronic pain. Unfortunately, or maybe fortunately, I'm in that 55 plus range now, and I can tell you that I definitely have some, some tweaks here and there, and some pain issues that that crop up here, from injuries and so forth. And this is one of the things that is very prevalent. And the stats, unfortunately, look like as we age, it will continue to get worse and worse with respect to chronic pain. Looking at specifics in Canada, anyhow, the number of hip replacements in 2007-8, these stats are a little bit older, is over 24,000, and the knee replacements almost 40,000. So, one of the ways that Western medicine, allopathic medicine, looks at the cure is to replace the damaged joint. But the whole idea, of course, is to be preventative about your health and never get to that point where you need a replacement. Some other conditions, fibromyalgia, I'll talk a little bit more specifically about that as we progress, and osteoarthritis. I won't go into all the details there. I'm not going to touch a lot on complex regional pain syndrome, but I do want to mention it because it does creep up. And if you do have this condition, I'm going to suggest highly that you do see a clinician before tackling it on your own. And the reason for that is that it is, as its name sounds, very complex. And it's one of these conditions where you do need some guidance from a clinician to help treat it. And of course, I'm going to be talking about chronic, or sometimes referred to as non-specific, both neck and back pain. When it comes to a treatment approach, using laser therapy, part of the strategy here is to treat centrally. So basically, I'm looking at suggesting that you treat around the spinal area to affect the nerve roots and the dermatomes and the rest of the nervous system, but also peripherally. So you may want to treat muscles, because muscles tend to be affected by inflamed joints, for example, or trigger points. So if you have tender spots on muscles, you can treat with light therapy as well. And also, one of the things, again, I will talk about at the end, is an active exercise program in conjunction with photobiomodulation. So some of the strategies for treating chronic pain with our equipment really depends on the severity of your condition. So by that I mean, if you're coming in with mild to moderate osteoarthritis, the number of times you're going to treat it on an ongoing basis would be different than if you were in that severe category. So generally speaking, I'm going to suggest once a week, but that could be 2 or 3 times a week. And this is, remember, to treat chronic scenario, not an acute scenario. So at the minimum, I'm probably going to suggest that you treat once a week. The idea here is that you want to promote consistent photobiomodulation, and this is going to help reduce inflammation and promote cellular repair. So the frequency of treatment will really depend on your own response. You may find that once a week is more than adequate regardless of the scenario that you have, but you may also find that you need to increase the number of treatments, and maybe you have a little bit of a flare-up or what have you. So it's an individualistic basis for that. One of the things that I'm also going to mention is that it's actually a good idea to take occasional breaks from treatment. And the idea here is that you're trying to prevent accommodation. Like any type of therapy, the body tends to get used to a specific type of, whether it's energy therapy or manual therapy. And taking a break from that and then reintroducing it can actually be very beneficial. So this can be done maybe every few months, 3, 4, 5 months. You take a break for several weeks before recommencing. You may find that actually being very helpful. As a general recommendation for a maintenance of chronic issues, I'm going to recommend using the system at the lower levels, so level 1 or level 2, as opposed to the higher levels. The higher levels tend to be much higher in pulsings of light, a greater stimulation and dosaging, and in general, maintenance levels should be a little bit lower level. And again, this isn't going to be, a hard and fast rule, but it's a general recommendation that that might be helpful. When we're looking at osteoarthritis, as everyone is well aware, it tends to be a fairly slowly progressing condition. And you know what? Believe it or not, it's really not symptomatic until you have significant amount of damage. In the case of arthritis, you're looking at maybe up towards 40% of degeneration of cartilage before you start to experience the cardinal signs of osteoarthritis, like swelling and pain and redness and that kind of thing. So the goal of treatment with photobiomodulation is to slow down the rate of progression of degeneration, decrease the chronic inflammation and the swelling, and help symptoms like stiffness and pain. Obviously, osteoarthritis is a condition that's not going to be cured, but it can be managed, and it can be managed in many ways. Typically, I would recommend a multifaceted treatment approach, including photobiomodulation. So by that, I mean things like exercise therapy, maybe manual therapy or acupuncture, those kinds of things where they may also offer relief as well. Whereas rheumatoid arthritis is a little bit different than osteo. It's an autoimmune disorder, so it's really your body attacking the joints themselves, and it can progress at different rates. Some patients, they say anywhere from 5 to 15, 20% of patients can have either long remissions without symptoms, or the symptoms can come and go. But most patients that are diagnosed with rheumatoid arthritis will have basically consistent progression of symptoms in varying degrees. So with reference to photobiomodulation, it can help symptoms in a positive way, but it's obviously not going to alter the autoimmune cause of the disease, and that's really because it's hereditary, genetic in nature, and you can't just turn off those genes, unfortunately. When we look at treating osteoarthritis with a hip joint, this tends to be one of the most challenging joints to treat with light, and that's because it's so large. And generally speaking, I'm going to recommend that you place the light arrays around the entire circumference of the joint. Now, of course, everyone is a different size, so you may need maybe 3 placements. You maybe have the P180, so maybe 3 is good. If you have the P120, you might need to use as many as 4 or 5 placements. But of course, the size of your joint is what is the determining factor here. So if we look at the hip joint, what you're seeing here are the outlines of the front of the joint, the side of the joint, and the back of the joint. I'm going to use my little pointer option here. Hopefully I can get that going. So the first placement I'm going to recommend is that you treat in the groin area. So I'm going to draw this in, and the array should be placed basically in this area. Now, it depends on the size of the array and the size of the joint, but the P120 or the P180 should cover basically that front aspect of the joint. Okay, so that's the outline there. The second placement is in the sort of the side or the lateral aspect of the joint. And again, you're gonna, it's really important to know where that joint is. So you can palpate the top of your hip, which is called the iliac crest. And then when you go down from the iliac crest, you'll feel a bump on your hip. That's the greater trochanter. And deep to that greater trochanter is where you're going to place that second array on the lateral aspect of the joint, like so. And then the posterior aspect, again, when you palpate the side of your hip for that greater trochanter bump, and out to the inside of the joint is where you're going to be placing the last array. And again, you may need 3, you may need 4. It really depends on what equipment you have, as well as sorry, I'm just trying to get rid of my pen here, as well as the size of the hip joint that you're dealing with. Now, when you're treating the hip joint, I'm going to recommend that you keep the joint. This isn't a great picture, but it's the only one I could really find that shows what's called the open pack position. Now, I recognize that not everyone can get their leg out like this. I want you to be comfortable when you're treating, but preferably you want to try to flex the hip joint and turn it out roughly 30 degrees. This is called the open pack position. So you don't have to be lying down like this person is. You can be sitting up, but your legs should be tilted out a little bit and externally rotated. You can put pillows or support underneath your knee. And again, I want you to be comfortable, but by opening your joint up like this, you actually allow light to go a little bit deeper into the hip joint. So my preference is to have your joint in this position when you're treating. If it's painful to treat in this position, then obviously don't use this position. When it comes to osteoarthritis of the knee joint, now I'm just going to take a quick break here. I just want to make sure that everyone, just making sure that everyone can hear me. I believe so. Okay. I always just like to double check that the volume is okay. When it comes to the knee joint, osteoarthritis specifically of the knee joint, again, it's quite a large joint and will require placements around the entire circumference, similar to the hip joint. The early and most affected areas of the hip joint is on the inside or the medial portion of the knee joint. So this is really important because when you're using photobiomodulation, I'd like you to concentrate a lot of the light in that specific area. Even overlap the arrays over that area would be recommended. So when you're treating, again, I'm going to have a little slide after this one that shows you that, again, I want the knee joint slightly flexed as opposed to completely straight. By flexing the knee, you should be able to palpate what's referred to as the medial joint line. Now, the medial joint line is where you're going to have the most significant amount of deterioration. If you've had x-rays, it usually shows that area mostly deteriorated. And it's this specific area that I want you to focus the light, even by overlapping a couple of placements over that area would be recommended. However, I also want you to treat the back of the knee. So in this first diagram you can see here, that's also really important to help with people that might have chronic Baker's cyst because of osteoarthritis. I'd also like you to treat the outside of the knee as well. And if you have any chondromalacia patella or chronic degeneration underneath the kneecap, it may also be advisable to do a placement over the patella or the kneecap as well. So again, as far as placement, as positioning of the knee, I'd like you to keep that knee flexed about maybe 30 to 40 degrees, and this allows that knee joint to be in an open pack position. You can use a pillow or a rolled up towel, and then, again, this allows light to penetrate into the joint as best as possible. Now, when you're dealing with chronic neck and back pain, I've had some webinars already on this. You know, the common causes of issues with the back and neck are everything from repetitive strain, poor posture, you know, computer work, that kind of thing. As we mentioned earlier, OA and RA, disc degeneration, fibromyalgia, previous history of whiplash injuries, spinal stenosis, prior spine surgery, so lots of different causes. The placements of the array for chronic neck pain really will vary depending on what your specific issues are. We tend to recommend a vertical placement, generally speaking, that's going to placed at the back of the neck, and just so the top of the pad is placed on the occipital region, or that sort of bump on your lower part of your skull. The second placement is in the mid-cervical spine and a little bit lower down. This can be placed up or down depending on where you have your symptoms. And we also do a couple of placements on the sides of the neck as well. This one is you're trying to get the joints at the side of the neck. And if you're having any radiating, chronic radiating pain because of nerve root compression, this particular position is also very helpful. Again, you may want to shift that array up or down depending on where you're having the symptoms. So again, just don't look at the diagram and follow it. Use your palpation skills and touch the area, find the areas that are tender, and try to place the array over those specific areas as best you can. When it comes to lower back, again, we tend to recommend treating the mid to lower lumbar spine with 2 placements shown here at 1A and 1B. But alternatively, if you're having issues directly in line with the spine, you can also do vertical placements as well. I do kind of prefer the 1A and 1B approach because you are getting a lot of the musculature on either side of the spine as well. And if you have any sacroiliac joint pain, you can also place the array directly over the SI joint. I do encourage you to understand your anatomy, so just do a bit of research on Google, and although I'm sure you know where your SI joints are if you have pain there. If you're having radiating chronic sciatic pain, you can place that array over the sciatic nerve and even on the back of your hamstring area to follow the path of the sciatic nerve as well. That may also be a good approach to help with chronic radiating pain. I wanted to mention this research, and this was published actually, within the last couple of years, and it was from the Annals of Internal Medicine, and it was guidelines for American College of Physicians. And it was quite a long, detailed guidelines. But one of the things I want to stress here that is a good takeaway is that they indicate that there's new evidence. Although, to be honest, I think we all know this, but they're referring to it as new. That active therapies, everything from Tai Chi and so forth, and Pilates, to mindfulness-based stress reduction, can be effective for chronic low back pain. So along with things like yoga and other types of active therapies, these types of things can be very helpful for chronic pain. So it's not a matter of just throwing on photobiomodulation. It's also really important to look at other options that you have to keep whatever movement you can going, and to do these active types of therapies. Fibromyalgia is a bit of a different beast. It's not really understood exactly what's going on with fibromyalgia. However, one of the main theories that they feel is central sensitization of the nervous system, also issues with the autonomic nervous system. That's like your parasympathetic and sympathetic or flight or fight reflex, neurotransmitters, hormones, immune system, lots of different potentials that might be involved. Now, central sensitization is a very complex type of scenario, but there's actually fairly decent research to show that photobiomodulation can help this. And basically what happens is you have some type of stimulus of the central nervous system. It could be chemical, it could be electronic signals, something that's causing activation of certain cell types called microglial cells, and they actually cause inflammation. And this will cause a release of certain chemicals that leads to problematic issues in the central nervous system, resulting in pain in your periphery and the rest of your body, but the location of the issue is probably more centralized in the central nervous system. Symptoms really vary. Oftentimes these folks have chronic fatigue syndrome, so they're quite tired. Obviously things like depression, anxiety make sense, sleep disorders, headaches, a very common issue, but of course these patients tend to have a lot of pain and stiffness all over their body, not just in one specific area. Other unusual symptoms, but they also may include things like tingless or numbness, TMJ problems, abdominal issues, those kinds of things as well. The main focus of fibromyalgia syndrome treatment is to try to work on reducing central sensitization and helping decrease localized pain. So we do usually recommend treating the cervical spine with that level 1. Try and stick with that. And you can use that cervical spine setting also for the mid and lower back, especially if you be sensitive to therapy. We do find that generally speaking, fibromyalgia syndrome sufferers tend to be sensitive to all sorts of different types of treatments, and photobiomodulation is one that they may also be sensitive to. So using that level 1 is actually a fairly good low setting that's nice to treat over the spine without risking sort of aggravating or temporarily aggravating the symptoms. Lots of different tender spots to choose from. So when you're treating those tender spots, I'd like you to focus on the areas that are most tender, and you can place the array. Again, you can use the regional protocol, or if you're sensitive, stick with that level 1 neck protocol over those tender spots, so the inside of the knee or the sacroiliac joints or the sides of the hip, those kinds of things. tend to be quite sensitive. Now, when you're placing the array on the body, of course, these arrays are emitting 2 wavelengths of light. You want to make sure that the red light and the infrared light is finished before you move it to the next position. Don't overlap the array unless, again, you're trying to treat a severely affected joint. The example I gave earlier was treating the medial knee joint, where you may want to overlap the array to really get a lot of light directly into that most affected area. And again, these personal therapy systems are designed to make direct skin contact, so you can strap them into place, or you can lean into a pillow or what have you, but please remove any straps or bandages or anything that you have on your skin before treating. So the array should make firm contact, and the better the contact, the more light that will go into the body. So I'm going to finish off by just talking about some other considerations with respect to chronic inflammation. And I do highly suggest that if you're suffering from chronic pain and chronic inflammation, that it's a multi kind of, I mentioned earlier, multifaceted approach. So looking at improving one's diet. And there are well-known anti-inflammatory diets out there that you can perhaps look at. Sugar, definitely reduce your sugar intake. It really is one of the most important things with respect to keeping inflammation, chronic inflammation at bay. Some other things, I won't talk about these ones in the middle, but specifically things like making sure you get enough sleep, reducing or stopping to smoke, improving your exercise routine. There may be other environmental factors that you need to consider. Sometimes moving out to the country, like where I live, that might be helpful to reduce chronic inflammation. There was a Cochrane review put out not that long ago that looked at chronic pain. And Cochrane reviews are really important because they tend to look at meta-analysis and systematic reviews of the research. And specifically, what they suggested here was that for chronic pain sufferers, there's a broad spectrum of physical activity and exercise interventions like aerobic and strengthening and flexibility. I've already mentioned Tai Chi and Pilates and yoga. These are all potentially very beneficial. There still needs to be more research done on it, but I think this is important. If you're treating chronic pain, you need to be more active. Yes, it may temporarily aggravate yourself, and you need to find what works best for you. But don't do things if it's prolonged aggravating. Certainly talk to your healthcare provider as well. A bit of muscle soreness after an event is fine. It's only when it lasts for a long time that you need to sort of tone things down. As far as safety goes and using our equipment, I usually mention that, of course, we use specialized LEDs. They're not necessarily a risk to your eyes, but if you're treating near the face, we do suggest that you wear the goggles, or if your eyes are sensitive, put the goggles on. You may place the array on your back or neck or whatever and lean into a chair, but if the array feels warm, let it cool down for 5-10 minutes before using it again. It's not to be used during pregnancy in the lower back or pelvic region, so that's important to know. Photosensitive medication typically doesn't involve the wavelengths that BioFlex does, but you can do a test area, just make sure that you're not sensitive if you're taking those specific medications, and always talk to your prescribing doctor as well. Obviously, you're not going to use it over actively bleeding tissues, over areas of a known cancer, and so forth. Now, to wrap things up, we do have a Black Friday sale. I will not tell you how much the sale is, because that's not that's not my job, but I do encourage you to give us a shout out if you're interested. These things tend to only happen once a year because we are a medical device company. It's not like we're selling things on eBay or Amazon. So if you're interested, you can give us an email at sales@bioflexlaser.com and inquire with respect to that. It's just for today through the 29th. For that particular sale. Thanks very much for listening. Again, the email below is for that sale. If you have any specific questions regarding this webinar, you can email me, david@bioflexlaser.com. I do really appreciate you taking your time out in your busy day to join me. And I'm just going to check to see if there's any questions as I go along here. So I have a question about what vitamins or minerals are best to enhance photobiomodulation. I do recommend coenzyme Q or ubiquinol. CoQ10, as you may also know it, is known to support mitochondrial health. So I would recommend that as well. Is it possible to measure cartilage restoration over time in a shoulder joint, for example? And how is this accomplished? Unfortunately, the research, when they did this, they had to excise and take samples, histological samples of the cartilage in animal models. In human models, it's very challenging to see the cartilage. You pretty much would have to do very specific imaging, whether it's CT or MRI. Even that, it may not be able to see the changes. So the idea here is those changes will be apparent because your movement will be better. You'll have less pain when you weight bear on those joints as well. Really, that's the only way to tell, unfortunately, without going in and doing a biopsy or invasive or expensive imaging. Do you recommend taking anti-inflammatories such as Aleve during therapy treatments? To be honest, the whole point of this is to try to reduce anti-inflammatory meds. If you feel you need to, that's fine. But the idea here is to reduce that because, of course, anti-inflammatories can have long-term gastrointestinal side effects as well. And of course, opioids can be addictive. So the idea is to try to use less of those preferably. But if you need to, then you need to, right? But the idea here is to use less of that. When treating the neck, does the light have any adverse effect in the thyroid gland? Generally speaking, you do not want to place the light directly on the thyroid gland, so it is contraindicated. And you'd only be doing that if you're treating the front of the neck, so you should block out the thyroid gland. It potentially can increase the activity of the thyroid gland itself. But yes, I would not place light directly over the Adam's apple or where the thyroid gland is. When you treat the hand for rheumatoid arthritis, do you treat both sides? Yes, I always recommend treating both the front, the palmar, and the dorsal aspect of the hand. That's really important. You mentioned to allow the laser pad to cool in between. Really only if it feels really hot or warm, if with prolonged use, or if you have it buried under pillows or that kind of thing. That's all I meant by that. Where is there a good placement for general health? Jerry, thanks for asking. I know you emailed me. So general health basically implies that you're trying to create a systemic anti-inflammatory effect. And really, I think the best spot there is treating the popliteal fossa, which is the back of the knee, where there's lots of blood. So if you were to do this on both knees, as far as which protocol to use, I would use the hip protocol. It's the longest one. Level 1, level 2 is good. Place it behind your right knee and your left knee. Do that once a day. Would promote general health, I think, and overall well-being. Jerry, sorry about not getting back to your email. Moving the pad to another or the same area, would that be correct? So basically, you don't want to treat the same area twice. Generally speaking, you can overlap a bit, as I suggested, if the joint's really affected, but you do want to move it to a brand new area when you're moving the pad, typically. What is a typical treatment time for treating gout? Treating gout, we usually use the foot protocol that's on your equipment. I don't know the exact timing, but I think it's around maybe 10 to 15 minutes, red and infrared combined, as I recall. I believe you mentioned take a week away from treatment. Right, so I did mention that you may take 1, 2, 3 weeks off every few months, just to give your body a bit of a break and to reduce accommodating from the treatment. What are the best treatment level settings for tennis and golf elbow or epicondylitis? Again, I'm just going to suggest that you use level 1 of the elbow setting to treat an acute flare-up of epicondylitis. All right, awesome. Thanks very much, everyone, for joining me. Really do appreciate your time today, and putting up a new list of webinars by the end of the week. So just check out bioflexlaser.com, go to events and webinars, and I'll have a new series of webinars coming out shortly. Don't forget to